The doctors love it because that's what they would have done anyway. They would have looked at it and said, "Hey, your labs are normal. Congratulations." So now the patient's relieved and they don't have to wait a week to get some providers, very short note like, "Okay, your labs are normal." They don't typically spend a lot of time on those. So patients love it, providers love it, and we've seen nothing but just overwhelming adoption. And I think that's gonna be the key here is providers just want help. They don't really care, is it AI, is it not AI? They just want something that works.
That's fantastic. I'm very relieved to hear that. And, I just think about the number of calls we get from just such a real place of concern by family members that it's random. You're seeing this patient for months and all of a sudden you get a call and they want the doctor to call back and explain every single red flag on the thing. And I need to be like, well, as discussed with a family member, because say they're moving it, from elsewhere to take care of them. That's because of the chemo and I'm going to make that call every time. But I guarantee you, that's also why I don't make any of my kids soccer games and like practices, because it's one or the other. And like you either have the doctor that will call you back, or you'll have a situation where you're just going to stress about these red things and think they're being ignored or not addressed, when in fact they are actually perfectly normally abnormal. And so I think this is something that can greatly reduce that. I mean, there's just so many, it's death by a thousand paper cuts of the moral injury things that every individual, not provider, but individual, just on who they are and in their circumstances with everything, is making. This is just an ultimate neutralizer for that. So I'm super excited. Is there something that, and you don't have to give away the secret sauce, that you're headed toward outside of the CBC CMVs? If it's imaging, if it's, so you have ambient, you have the note writing, I assume probably something with prior auths, et cetera, justifications for iron infusions, which drives me nuts because let's say the ferritin high, I'm like, that's because they have cancer. Like it's an inflammatory reactant. There's so many things that I could go on about that I spend my time with in right to the patient.
Well, we have to tackle, a few things. So we're doing lab results. We're doing, prescription renewals, which also, vary for providers. We're introducing imaging next quarter, so that'll be a really nice thing. And we're focusing on the outbound, the communications with the patients, helping to close care gaps, getting patients to fulfill the lab orders we order for them that they don't always do, and that's really where we're going as a next step. So it'll be nice to be able to have AI helping to get patients more connected with providers and get them to do the things that the providers want them to do. And having doctors follow up with AI assistance is a whole opportunity. And that's where we're tackling.